lots to discuss and a very exciting session ahead of us. But firstly, welcome, and it's lovely to see everybody joining us this afternoon from various places. Just a few housekeeping bits before we start. We are recording this presentation, but we'll stop for the question and answer bit at the end, which we'll come on to. So welcome. But many of you might know today is World Menopause Day, 18th of October. And this is the whole purpose of bringing us all together, encouraging us to talk, friends and family, about perimenopause. Now, before we start, who are we? So CRE, we're the largest digital healthcare provider in Europe, and Livy is the UK arm of CRE. And we want to close that gender health gap and start this conversation. And we want you to know that it's okay to have hot flushes, okay to be off sex, okay to talk to your friends and colleagues about such an important phase of life. So when we look at menopause historically, so menopause was first mentioned as a disease in 1710, so a long time ago. And as time has passed, medicine has long misunderstood the menopause and looked at the symptoms of menopause about hysteria, kleptomania, so impulsive stealing, amongst others. And when we look at the treatment of menopause over the years, in 1800, mustard ice baths was mentioned. Now, I've no idea what a mustard ice bath is, but certainly, thankfully, not something that we would do now. Cold water to the abdomen, arsenic was even mentioned. But as I said, thankfully, times have changed. It's time to start that discussion, inform and break down the fear about this completely normal phase of life. So today, what we're going to cover is, what is it? What is the perimenopause? What causes it? What might I feel? How can I manage it? We have got a question and answer session at the end. There should be a Q&A function on your screens. So do ask away and we will come to the questions at the end. But before we get there, how much do you really know about the perimenopause? So who are we? I'm Dr. Bryony Henderson. I'm one of the lead GPs at Livy, and I'm joined today by Louise.
Hi, my name is Louise, and I work as a business developer within physiotherapy at CRE, and I'm also a physiotherapist. And I'm also here today to talk about physical activity during perimenopause.
So, as I mentioned, a bit of a quiz before we get started. Now, everyone can jump on their phones. There's a QR code there to link to. Alternatively, go to slido.com. You don't need to register, just put the hashtag Peri22 into the search bar, and you can join us for this quiz. So, first question: perimenopause is when you are too old to have a baby. True or false? So we've got false 88%, changing as I speak, and true 13%. So the answer is false, absolutely right. So perimenopause lasts for a few months, sometimes to more than 10 years, typically 4 to 8 years, and the average age is 48. Now, the average age of menopause, so when your periods stop altogether, is 51 in the UK, but can be anything between 40 to 58. So it can actually happen when you are still young. And absolutely false, you can very possibly have a baby or fall pregnant within the perimenopause period. So next one, every woman will experience the perimenopause. True or false? So we've got 88, 13. So the vast majority at the moment on the true side. So let's pick up the answer. So every woman will experience the perimenopause. False. So there are two ways of going through the menopause. First one, it's naturally, you're just letting your hormones do their natural timeline. However, it's possible to have what we call a surgical menopause. So you have an operation to have your ovaries removed, or induced menopause, like some medication can push you into menopause, or even cancer treatment can. And for these women, there will be no perimenopause period. Your periods will just stop. So, last question. Humans are the only species that go through the menopause. True or false? So we've got a bit more of a split on this one, 70% false, 30% true. So the answer is actually false, and surprisingly not a monkey, which I think would be my first idea. So killer whales are the only other animal to go through the menopause. And this brings us on to why. Why do we go through the menopause? And it's called the granny theory. Now, this is not based on a grandmother, but it's the name of the killer whale that was actually studied, Granny the killer whale. And Granny lived for a long time, and she remained menopausal for the last 30 years of her life. Now, during those 30 years of her life, she helped her family, taking them to the best fishing areas and thereby passing on health to the rest of her generation and the rest of the generations below her. Now, whales are very family-centric, and people are too. So Granny was passing on knowledge and family success, and this is possibly why we think that the menopause exists. So, perimenopause educated. So what is the perimenopause? Now, when we talk about going through the menopause, we are generally talking about this perimenopause, and it's the start of the transition to menopause. Perimenopause is the build up to the period stopping altogether, and it's caused by hormone changes. And we'll come on to that in a minute, because I think it does help by looking at it from a hormone perspective. And that explains a little bit about what is happening and why we experience what we do. So what causes it? It's essentially when your body begins to produce less estrogen. So we're going to look at the estrogen levels and what happens during your life. So here at about 11, you start your periods. Now, you just normal cycles for you until the perimenopause. As I mentioned, perimenopause usually starts about 8 to 10 years before the menopause. And that average length is about 4 years. Now, the menopause is when your periods stop altogether. We can only diagnose the menopause in retrospect. We have to go 12 months of no periods before we can say that you are menopausal. Now, you can see here what's happening to the estrogen level. Your estrogen levels are nice and high during the premenopause period. During the perimenopause, they're all over the place, and your ovaries are starting to make less hormone. And it's this estrogen that we're particularly looking at. Now, as the estrogen level goes down, your body tries to produce eggs. Your body is trying to push your body into make your ovaries making eggs. And as a result, another hormone called FSH, stands for follicle stimulating hormone, rises. Now, it's really common for these levels to fluctuate up and down during this time. But eventually, the amount of estrogen is just so low that the ovaries no longer release eggs, periods stop. And then once you've gone 12 months without a period, you're no longer in that perimenopause, but the post-menopause period, and that lasts for the rest of your life. So this leads you on to, so what might I feel? So your body has got some big adjustments to make. It's been living with that estrogen level since puberty, as we looked at that chart. Around 11 when periods start, estrogen levels are nice and high. So the symptoms you might experience vary, but let's take a look at some of the common ones. So period issues. So your body is producing less of the hormones that help ovulation. So your eggs being released. So periods may become irregular, heavier, lighter, or even infrequent. Combined with this, hot flushes. So about 80% of women complain of hot flushes. Vaginal dryness. So estrogen lubricates. And with reduced levels, you can experience vaginal dryness. Together with this, bacteria can actually climb up the urethra, the urine tube between the outside world and the bladder. As things get a bit drier, they can cling onto the walls a bit easier. So you can experience UTIs or urine infections a lot more frequently, hence that needing to pass urine frequently. 50%, so half of women going through the perimenopause report mood disturbances. And there can also be decreased sex drive. So lower levels of another hormone, testosterone, can produce that lower sex drive. However, there are a lot of other symptoms, more subtle ones, that we may not traditionally associate with the perimenopause, but which are commonly reported by women. So if we look at teeth, lower estrogen can cause inflammation and therefore can produce gum disease. So it can be red, swollen, or bleeding gums. Now, dentists have very little training on the perimenopause and the menopause. So it's important to see your GP if you see any of that, but continue good oral hygiene. So do go and see the hygienist and dentist regularly. Really important to look after your teeth during this phase. Body odor. So estrogen has an effect on a part of the brain called the hypothalamus. Now this area controls temperature regulation and therefore the hot sweats. but it can also make you sweat more easily sometimes in places that you don't normally, such as the nape of the neck, often women tell me. And that can change the environment of the skin and the bacteria that are present, and it can change body odor a little bit. Some 20% of women report tinnitus or ringing in the ears, blepharitis, so red, burning eyes, or that annoying feeling that something is in your eye. So really important to be lid hygiene, cooled boiled water to wash your eyes with. And also hair loss, thinning. So perimenopause can also affect hair. It can change quite rapidly, be a bit thinner, wispier, frizzier, or even fall out in patches. So how can I manage it? I think what we've got to remember, this is a natural, normal part of a woman's life. We can't stop it, but there are lots and lots of things that we can do to help manage it. Some things that you can do to help, others that a doctor can discuss with you. So eating a healthy diet, so nutritious, healthy food, things like complex carbohydrates, rich in fiber, help sustain blood sugar and cause sort of sustained energy, such as oats. Quinoa can also help. Lean protein, chicken, fish, and healthy fats, so mono, polyunsaturated fats, all have been shown to reduce hot flushes, things like olive oil, avocado, for instance. Exercising, I'm going to leave that for a minute because we're going to come on to Louise in a minute, who's going to tell us far more about exercising. Avoiding stress. So this time in life can be physically, emotionally draining too, as we've discussed. So meditation, deep breathing can all help. And important to ensure you get enough sleep. So some of the negative symptoms, you can help yourself by getting enough sleep, but better prepared to deal with it. So it improves energy, helps mood as well. As we mentioned, estrogen lubricates, and as the estrogen levels drop, things can become a little bit dry. So vaginal lubricants really can help with vaginal dryness, make sex more comfortable as well. And avoiding some common triggers for hot flushes, synthetic clothing, spicy foods, alcohol, all those have been known to trigger those hot flushes. And obviously smoking, alcohol, as we mentioned, all have been shown to worsen symptoms. So what can a doctor do? So, I mean, the first thing we do is we talk. We will listen to what you're experiencing and your symptoms. Now, we can also then diagnose the perimenopause or even indeed the menopause. Now, if your symptoms are typical, you're above the age of 45, then there are no need for any tests. We can go on symptoms alone, providing it all fits within that menopause. Now, sometimes blood tests may be arranged to check there are no other causes to your symptoms. This is particularly if the symptoms are a little bit atypical or if you're under the age of 45. The blood test that we're looking for is that FSH level, the follicle stimulating hormone level. That's the level that we're testing for. As I mentioned, it goes up during the perimenopause. So a very high level or even two low levels or slightly high levels, 4 to 6 weeks apart is what we're looking for. Now, as we mentioned in the quiz, it's important that we consider contraception during this time. So it is important because you can possibly fall pregnant during the perimenopause. So your GP can talk and discuss with you what is suitable for you. So it could be pills, coils, implants, lots of different options. HRT, if we're going to come on to that in a second, but HRT is not a contraception. So really important that you don't rely on that alone. And then treatment for your symptoms. So the most common treatment, as I'm sure we're all aware, is HRT, so hormone replacement therapy. Now, there are lots of different forms that this can be given in. So dryness down below, if that is the sole symptom, or recurrent urine infections, things like cream can be given, estrogen cream. It's very effective and safe. It just acts where it's given. You might alternatively be advised to take what we call systemic HRT. So that acts throughout the body in the form of patches or pills, and it involves giving estrogen back, and if you still have a womb, progesterone as well. Some preparations of HRT you take continuously, others will give you monthly or even periodic bleeds. They're both given at slightly different times of your life, but your doctor will be able to advise you which one is the most appropriate for you. So we're going to move on to Louise for the exercise part. Louise.
Thank you so much. You can change the slide, please. So I'm here to talk about physical activity. during a perimenopause and how you can get rid of the symptoms. And during a perimenopause, it should always contain both condition and strengthening elements when you do physical activity. And you can always follow the general exercise principle for adults, which is 30 minutes of moderate physical activity per day. But to get rid of the symptoms, you have to have an intensity of 70 to 80% of your maximal heart rate. And you should do that 3 times a week in 30 minutes every time. You can always divide it, split it in 3 times 10 or 30 minutes in a row, but you should always have an intensity of 70 to 80%. And this is to prevent osteoporosis, cardiovascular diseases, reduced risk of hot flashes and sweat, urinary incontinence, and it can also improve your mood. But how do you know if you have an intensity of up to 70 to 80%? Well, you will feel it in your heart. It will start pumping really fast. Your breathing will get much heavier. You should absolutely not be able to sing during your physical activity, but maybe you're able to talk a little bit. And you should not forget your strength. You should always do that, and you should do it 2 to 3 times a week. And it's a series of 3 to 8 to 12 repetitions. And that should also be done close to maximum capacity. And the muscle groups you should work out with is the abdomen, the pelvic floor for incontinence, the gluteal, thigh, arm muscles, and the back. It's also very important to retain your flexibility, so you can always add some exercises to that. And also here, how do you know what your maximum capacity is when you're working with your strength exercises? Well, if you're sitting and having a weight in your arm and lifting it like this 8 times, it's not close. It should be as heavy. The last repetition should be so heavy that you want to drop your weight until the floor. You can change slide, please, Bryony. And here's some suggestions of what kind of activities that are good for you. You can do everything from Nordic walking, dance aerobics, step up, strength training, as I mentioned, jogging, cycling, everything are really good activities. But a lot of people ask me about swimming, and swimming is fantastic. It stimulates your muscles and fitness, but it has no effect on osteoporosis. And I just want to tell you that osteoporosis is a health condition that weakens your bone and making them fragile and more likely to break. So it's really important to do regular exercises to keep the bone as strong as possible. And you do that with high impact training. Next slide, please. And thank you. It's very good to vary your physical activity. You can do whatever suits you. You can do group training or you can work out at home. But the most important thing is that you're actually doing something. Otherwise, it's no possibility that you can get rid of the symptom. So it's better to find something that suits you, even if it's at home or in group sessions. Just do your exercises. Next slide. And are there any risks with physical activity? Well, it could be if you're increasingly too rapidly, it could cause a risk of overload symptoms, which can take a long time to heal. But if you listen to your body and have a nice intensity, frequency, and duration, it should not be any problem at all. And last slide I want to show you is that it's taking time to build up your body. Very long time. So have patience. It takes at least 3 months to feel anything of your well-being and hot flashes if it's had regulated or had any reduce. It takes at least 1 year to measure your bone density. It takes at least 6 months to measure your fitness level and lipid weight levels and the effect of aerobic training. And the effect of the pelvic floor muscles and incontinence can first be seen after 3 to 4 months, and you will feel it by yourself. So my message here is that you're actually doing some workout than not to get some effect during your perimenopause. Back to you again, Bryony.
Thank you, Louise. So we're not doomed, far from it, in fact. So it's a really exciting phase of life, and menopause, as we mentioned, marks the end of the menstrual cycle, which for many women is a cause for celebration in itself. So no more periods, no more tampon, pad fuss, no worry about leakage, no more cramps. You can wear white again. Now, no more hormonal headaches. So about 70% of women have menstrual migraines, so headaches that coincide with ovulation and menstruation. Now, after menopause, as we've already mentioned, levels of estrogen and progesterone fall, and often the number of hormonal headaches declines too. PMS, that dreaded word, so at least 85% of all menstruating women experience one or more symptom every month. And as estrogen levels rise and fall, and then fall in the menopause period, PMS disappears. Now, greater self-assurance and liberation. There was an American anthropologist, Margaret Mead, who called it menopausal zest. And that's a rush of energy, physical, psychological energy that some women feel after menopause. And it's a great time to take stock of our lives. Children are older, you can pursue personal, professional goals, all sorts of exciting things, particularly when not having those monthly cycles and those mood swings. And it's time to embrace change, be more receptive to change as well. So a lot of very exciting things going on in this time period.